So excited to see you all and be with you. I want to thank our finance director, Joe Lombardi, and his team at the finance department, all of our cabinet directors, Erica Clark-Jones, CEO of Adam H., who has joined us, Dwayne Casares, CEO of Directions for Youth and Families, Carly Boos from the Affordable Housing Alliance of Central Ohio. The last year has wreaked havoc on our community with a global pandemic, economic recession, a spike in violence, and a national reckoning for racial justice. With less funds available for new spending in years past, our capital budget must be laser focused. We've heard loud and clear what residents want: police reform, affordable housing, and investments in our neighborhoods. Today, I'm announcing a capital budget that reflects those priorities with almost $113 million in new spending. In a few moments, Finance Director Lombardi will explain how we arrived at this amount and why it's financially sound, even in these tough economic times. As you all know, we usually announce our capital budget in the spring. The uncertainty of revenue this year because of the pandemic required us to delay until we were more certain of where our numbers stood. I'm confident with the amount of this year's capital budget and with the projects we're funding. There's been a great deal of talk this year about policing. Defunding has become a buzzword. But what we need is investments that take some of the burden off of our officers and into addiction recovery and mental health, so that our officers can focus on what they were hired to do: keep our communities safe. We are committing $10 million for Adam H. to build a new facility for addiction recovery. Any of you who have seen the ravages of addiction, like I have, know that the last place someone facing an addiction crisis should be is in jail. We've seen addictions rates skyrocket in our city and our county over the last several years. And since the pandemic arrived, overdose deaths have increased by more than 70%. Just a few minutes, Adam H. CEO Erica Clark-Jones will explain what this investment means to our residents. Other capital expenses in this budget include $1.5 million for body-worn camera server storage to assure the extra server capacity needed for this important tool that improves safety on both sides of the camera. As we have earmarked $3 million for a joint wellness center for police and fire that will focus on all aspects of first responder safety and wellness. The Columbus Community Safety Advisory Commission recommended training to deal with burnout, secondary trauma, and coping mechanisms. The center will be an investment in first responders' wellness to improve their physical and emotional health, yielding positive outcomes for them, their agencies, and the communities they serve. Our officers and first responders are there to serve and protect. We must ensure that they're bringing their very best selves to serve and protect everyone in our community. As a growing city, Columbus faces the challenge of making sure that residents who work in our city are also able to live in the city. In a few moments, Carly Boos with the Affordable Housing Alliance will talk about the specific needs in the community. In 2019, Columbus voters overwhelmingly approved the sale of $50 million in bonds to help provide affordable housing. With the approval of this budget, Columbus will be able to leverage those dollars for affordable housing in many different ways. First, $11.5 million will be dedicated to the construction and renovation of affordable housing units. This investment will leverage an estimated $83 million in total investment and 510 affordable housing units over the next 24 months. This includes $1 million earmarked specifically for the Linden area to foster speculative affordable housing development, including land acquisition for future affordable housing development. Our affordable housing spend includes a $6.6 million city investment over 2 years to Mulvey Place at the corner of Cleveland and Myrtle, a building block for downtown Linden, rooted in the One Linden Plan. The project, being developed by Homeport, will include 100 affordable apartments for seniors, 5 single-family homes, and commercial space. In addition, $2.5 million will be invested through community development for all people for affordable housing on the South Side. This represents the second half of my $5 million commitment to the South Side community. Once complete, this investment will provide 75 new and rehabbed units. And finally, $2 million will be allocated to housing preservation to increase the local supply of decent, safe, and sanitary housing and decrease the number of vacant properties in our neighborhoods. Investments in neighborhoods have never been more important. Oftentimes, you've seen throughout history that investments made in difficult economic times are even more important and significant and have a longer lasting impact than in good economic times. That makes this capital budget more important than ever. Dollars spent from the capital budget will help ensure each of our neighborhoods are safe, vibrant, and thriving in ways that our residents can see and feel. We've allotted $500,000 for community development for all people to be spent in Linden to support homeowners with exterior repairs such as concrete repairs, painting, siding, and windows. In addition, $1.5 million will be spent for the Linden Community Recreation Center road entryway and $3.7 million for the Hudson Avenue reconstruction from I-71 to Cleveland Avenue, adding a shared use path and improving the sidewalk, curbs, and lighting on this critical thoroughfare in one of our most important neighborhoods. The Hilltop neighborhood will see an additional $6.5 million for the Hilltop Education Center for high-quality pre-K in this underserved area. We know that the Hilltop has the largest number of 4-year-olds that are not enrolled in high-quality early learning programs anywhere in the city. We expect to break ground later this year and open the center by the 2022-23 school year. In addition, on the west side, $10 million is being allocated for the Sullivan Avenue infrastructure improvements announced earlier this year. These funds will go towards replacing existing sidewalks where necessary to make them ADA compliant, sealing pavement cracks and replacing old striping on roads, replacing deteriorated curbs and damaged signs, replacing traffic signals and upgrading streetlights, adding bump outs to slow traffic in certain locations, and adding flower pots and other beautification to beautify the neighborhood. Design work for pools at Glenwood on the Hilltop and Windsor in Linden will also get underway in 2021 for additional safe spaces for summer engagement for our families. Design will begin on a community creative campus and park located on Columbus's near Eastside at the former Douglas School that the city has acquired. This campus will become the future home of Martin Janis and the Golden Hobby Shop programming. Approximately $10.2 million, about half of Recreation and Parks' total capital budget, is dedicated to the care of existing facilities and parks, such as the renovation or replacement of facilities, playgrounds, shelters, and sports courts. Paired with federal grants, this will allow major improvements at 11 parks in our opportunity neighborhoods and roof, building, and HVAC improvements to community centers, shelter houses, and athletic complexes. In the Eastland area, we have earmarked $1.4 million for the Crittenden Community Center on the Far East Side as part of a $7.5 million public-private investment with directions for youth and families. In a few moments, Dwayne Casares will talk about this center and what it will mean to the Kimberly Parkway community. The city is also committing $1 million towards a new Boys and Girls Club facility to be located across the street from Rogue Fitness in Milo Grogan. It will be a 24,000 square foot state-of-the-art facility with a teen center, community gathering space, and full-size gymnasium. The club will have the capacity to serve 250 young people a day. And you all know that the more touch points we can have with our youth, the more likely they are to be successful in school and in life. Safe streets and sidewalks are crucial to all of our residents, and we have committed resources for many projects across the city, including on the Hilltop, sidewalks for school areas along Olive Street and Floral Avenue and Kingsford Road, from Briggs Road to Eakin Road, all on the Hilltop. On the east side, reconstruction of James Road from Livingston Avenue to Main Street, provide sidewalk and bike facilities along with ADA accommodations. In Northland, design improvements from Maple Canyon to Cleveland Avenue to include pedestrian and bike facilities, new traffic signals, raised medians on side streets, and installation of mini roundabouts and sidewalks along the east side of Maple Canyon Avenue. I'm excited about these investments and how much they will do to improve the lives of our residents. Even more proud that these investments that we're making during difficult times are through the lens of equity, doing our part to make sure that we're investing in neighborhoods and our neighbors that have been left out and left behind by the success of Columbus. Dynamic, inclusive growth and recovery. And you see that reflected in these priorities of this capital budget. Now, I'd like to give a little more information about the $113 million for new spending. I'll turn the screen and this part of the press event over to our Finance Director, Joe Lombardi.
Thank you, Mayor Ginther. Good afternoon, everyone, and thank you all for being here today. I would like to just take a few minutes of your time to provide a very high-level overview of the 2020 capital budget that the mayor just presented. Despite reduced revenue estimates, but due to sound fiscal management, the city is still able to invest in high-priority projects in 2020. The city will invest nearly $113 million in new projects that are funded by additional capacity that will be supported by the Special Income Tax Fund, also known as the SIT. As you know, the city sets aside 25% of income tax received to pay the debt services for these projects. This $113 million investment is in addition to planned projects by city agencies. When all resources are considered, that includes new funding and carryover dollars, the city's 2020 capital budget equals $1.4 billion, including $990 million for public utility projects, which debt service is supported by utility fees. Furthermore, public utilities also fund several infrastructure projects through the State of Ohio Low Interest Loans Program. It should be noted that the city continues to maintain the highest bond rating from all three rating agencies because of the city's financial management and its policy. I will be available to talk in more specifics after the press conference. Thank you again for being here today. I would like to introduce Erica Clark-Jones, Chief Executive Officer of AdamH. Erica?
Thank you, Joe. I appreciate the introduction. And Mayor Ginther, thank you for inviting me to join you today for your capital budget announcement. And thank you for recognizing the community's need for mental health and addiction services and for your commitment to ensuring equitable access to these services across our community. My name is Erica Clark-Jones, and I do serve as the CEO of the Alcohol, Drug, and Mental Health Board of Franklin County. And the AdamH network, just as a level set, is a network of agencies that provide mental health and alcohol and drug addiction programs to the most vulnerable in our community. These services for children, adults, and families include crisis care, residential and outpatient treatment programs, school and community-based prevention programs, housing, and recovery supports. Now, I would be remiss if I did not take a moment to thank Franklin County voters for their vote of confidence in AdamH and our providers with the passage of Issue 24 just this past Tuesday. Franklin County voters have helped to ensure that AdamH has resources not only for existing programs and services, but for future resources to invest in unmet and emerging needs across our county. Mayor, you so bravely shared some of the statistics and of the challenges that we are dealing with. We know that the number of Franklin County residents is expected to grow by 8% over the next 10 years. And during that same period, we anticipate a 23% increase in demand for mental health and substance abuse disorder services. Right now, approximately 70% of all crisis encounters related to mental health and addiction are currently treated in our hospital emergency departments, despite evidence that outcomes are better when services are provided in a community-based setting. A high priority for AdamH is to address the continuum of crisis care in our community and reimagine how crisis care is delivered across Columbus and Franklin County. The cornerstone of this commitment is the development of a crisis care center where services are co-located in one place so that a person in crisis does not have to be transferred once or even multiple times during a personal crisis event. The Crisis Center will provide access 24 hours a day, 7 days a week, 365 days a year to adults ages 18 and older, as well as their families. We also will provide access for hospital systems, our first responders, and our safety forces, probate and community-based providers who need access to crisis care. This center will be the central and primary destination in Franklin County for mental health crisis needs and will offer a no wrong door philosophy to ensure that anyone who arrives at the center receives services. The center will be a hub for services, including but not limited to a walk-in clinic and timely community-based provider linkage services on site, a 23-hour observation unit providing a safe setting for treatment for those in immediate crisis, an inpatient grade unit with 16 beds for stays that are 24 hours or longer, substance use disorder treatment services, including the initiation of medication-assisted treatment and linkages to ongoing care. It will also provide family support services as well. This hub of service benefits everyone, from the person in crisis to their families, to overcrowded hospital systems and our valued first responders. The center is much bigger than AdamH. It is a community-wide project and a community-wide investment. Our process includes voices from several community stakeholders in the center's development. Community behavioral health providers are at the table, hospitals, our public health departments, both from the city and the county, law enforcement officials, advocacy organizations, Mental Health America, and NAMI of Franklin County. But most importantly, we are listening to the voices of the people who use the behavioral health system and their families. Through careful planning, we envision a center of approximately 72,000 square feet and an estimated $50 million in construction costs. Mayor, the $10 million commitment in the City of Columbus's capital budget will bring us closer to our goal of $50 million for construction, with a total right now of $36 million in committed financial support. With this support, our efforts to secure additional funding from the state legislative leadership and our local and corporate philanthropic partners, we hope to break ground in late 2021 and begin serving the community in 2023. Thank you, Mayor, for helping to bring this crisis center online. And now I have the privilege of introducing Carly Boos, Executive Director for the Affordable Housing Alliance of Central Ohio.
Good afternoon. Thank you, Erica, and thank you, Mayor Ginther, for the invitation to join you today and for all of the support that you've shown for affordable housing initiatives in Columbus. On behalf of the board and members of the Affordable Housing Alliance of Central Ohio, I also want to commend the partnerships that you've forged with the Columbus City Council, Franklin County Commissioners, and many of our public, private, and philanthropic leaders, which have together elevated our city's reputation for housing innovation to the national level. And it's lucky that we have the A-team working on this problem, because as you know, Central Ohio is in the midst of an affordable housing crisis that is going to take all hands on deck to fix. 54,000 of our low and moderate income neighbors pay more than half of their income towards housing costs. That is not sustainable for the families impacted. And as COVID-19 has so devastatingly shown, it is unsustainable for our community as well, both economically and ethically. We know that the affordable housing puzzle is complex and no single solution is capable of solving the challenges we face all in one shot. Instead, we must have a diversified and agile and creative response. We must be prepared to critically assess the regulatory barriers to affordable development, to expand the supports that we provide to move people towards self-sufficiency, and to develop bold programming and policy solutions that ensure every one of us has equal access to opportunity. And it is a privilege to know that these initiatives are well underway in Columbus. And today's announcement adds another tool to that ever-growing toolbox. Our peers at the Building Industry Association have reported that Columbus needs to build 14,000 homes per year just to keep up with the pace of growth. And yet, before the coronavirus struck, we were creating less than 8,000. And unfortunately, too many of our indicators are now moving in the wrong direction. Just today, the Affordable Housing Alliance released a report finding that price jumps in lumber and labor are pushing affordability further out of reach for our home health aides, for our auto technicians, for our bank tellers, for our family, and for our friends. Now we've reached the tipping point where we're feeling some of the worst impacts of that housing shortage. Long lines at eviction court, parents unsure how they're going to get their kids an education, and seniors forced to ration food and medicine to stay afloat. That's called the toxic trade-off. But with today's landmark investment, we are taking some of the first steps towards ending that cycle and building a stronger, more equitable region. These resources will create a permanent lifeline for so many of among us. It will build housing communities that nourish the residents that live inside them, while fueling an economic development renaissance for the neighborhoods that they're situated within. And as you've said, it makes sure that all of those who already live and work here have access to the safe, decent, affordable homes they need to thrive. Of course, we know this is the beginning, not the end, of a journey to eradicate housing instability, particularly for the most vulnerable members of our community. But as the old saying goes, a journey of 1,000 steps begins with a single one. And today, I'm confident we didn't just take a single step, we took a massive $11.5 million leap towards a better future. So thank you again for this opportunity to speak, to answer any questions you may have, and thank you for your ongoing commitment to our neighborhoods. Thank you.
I'd like to introduce Dwayne Casares, CEO of Directions for Youth and Families. I almost stumbled over the name of the organization. I was just with Dwayne this morning celebrating over at the Crittenden Community Center and the incredible impact he and his team are having on that neighborhood, but also talking about his vision for community restoration and trauma-informed care and support for neighbors in that community. So, Dwayne, I'd like to talk about this incredible partnership that we started talking about just about a year or two ago that we've been able to realize and work on together, and the impact it's going to have. I remember talking to one of your team members this morning, and I think you're currently serving 70 children in that neighborhood. And when this facility is realized and opened up, you'll be able to serve over 400 a day, which is just incredibly important for that community and neighborhood and all of the family stability and stabilization work that you're doing there. So, Dwayne, I'll turn things over to you and have you talk a little bit about directions for youth and families in this Crittenden Community Center.
Thank you, Mayor, and thank you for coming out today. I want all our listeners and viewers out there to know that the mayor's tie actually matches our colors of the agency. So this is just very, very well planned. You know, one of the things that happened when we first opened the Crittenden Center some 5 years ago, we were filled, as the mayor said, we serve 70 kids there now, and because we're limited by space, it's about 3,500 square feet. Within 2 days, our facility was filled. That's when we moved things into shifts, and then we got filled up 2 days later. We rented some space down the street. We were filled up by the end of that week, and then we had our open house. And I remember the principal from the middle school coming and saying, Dwayne, this is great. This community needs so much. I can have you filled up. And I said, look, there's no more room at this end. We knew then that we had to build a bigger facility so we can meet the needs of this community. In that journey, we discovered many different things and many different deficits. The Kimberly Parkway community is #1 in evictions. It tied Linden for #1 in infant deaths. It's #3 in poverty. You don't hear about these things all the time about certain communities. And we knew we had to do more than just open an after school and summer program center like we have our Ohio Avenue Center. Most of our agency is counseling, so we have over 50 licensed therapists and counselors who work with over 6,000 people in the community each year. And it's all outreach, so we're in all the communities. We know what it's like on a very regular basis. We know the challenges that our families face. We understand what toxic stress is, and we kind of took our trauma and resiliency approach of mental health and moved that into a community-wide perspective. With that, we started working with Bridge Housing Corporation in San Francisco, who had developed the trauma-informed community building model. We added the 5 social determinants health and also Annie Casey's 2-gen model to put together a model that we think will really move towards restoration, working with communities. So not just throwing stuff at them, but having them be parts of it. Way in the beginning, we were very fortunate. We would take groups of moms from the Kimberly Parkway community to our Ohio Avenue Center so they could assist us in our vision and just open up how they could dream about what we could build. And fortunately, we already had Ohio Avenue that we could use as we actually show it to many people because it's a beautiful center. And we do great work there with the arts and the dance and music and homework help and leadership development. We've actually sent 7 kids in the last 3 years to college from that center. And we're very proud of that. Some of them have been with us since they were in the 6th grade, and they're doing wonderful. I remember one of that first meetings, one of the moms said at the end after we gave our presentation, I said, what are we missing? What else do you need? One of the mothers said, I can't believe you're willing to do this for us. You know, that has stayed with me and motivated me all these years. No human being should never feel unworthy of getting basic needs, of having food, of having shelter, of having a safe place for their kids. You know, these are all things that many of us had. As the mayor and I were talking earlier, I said, you know, this pandemic and everything that's going on has it's really stressful on all of us. But the people we serve have fewer resources than most of us. And what do you think is happening with them? So in looking at that, we knew that we could have a vision of community restoration and working with the community. We just needed to have the right partners. We have now really garnered the support of 17 different nonprofits. I always said we can't do all the work. There's many people out there that can do it. We just need to partner with them, and it's important to have the right partners. I remember talking to Elizabeth Martinez at Big Brothers Big Sisters early on in the process. She's one of the first people who signed on because we could extend our counseling services if we had them step in. We knew because of the infant mortality rate, it couldn't stop, so we partnered with Ohio Health and brought out their mobile clinic. We've been doing that now for 2 years because we had to cut into infant mortality. We work with the Center for Healthy Families and Moms to Be in another program just to address infant mortality, and they'll be partnering with us as well. Like I said, it was #1 in evictions in that area right now. So, Homeport and CPO came on board. ETSS is there because of the large West African presence that are there. Columbus Works is going to work with us as part of our job training and job skills. Catholic Social Services will be coming on with us to provide the senior services. So we really have looked at how we can when we work with individuals, we always look at it from a cognitive, emotional, behavioral standpoint. So how you think, how you feel, how you act, because you need to address all of those things in order to help an individual heal. We're applying that same thing on a broader scale to toxic communities. It's just not one size. You have to adjust to the needs of each community and address all of these areas so that you truly can have a very healthy approach to this entire process. I have to give a shout out to you, Erica. The Adam Board is part of one of the agencies that is funding this initiative as well. We've worked with the Adam Board for so long. So Erica, thank you. When Erica first came on board, I'm one of the people who clogged her schedule early on just to talk to her about this initiative, and she was so enthusiastic about it and so supportive, and we're grateful for that, and we're grateful for all the supportive people who have been out there in this journey along with us, so that we really can meet the needs of communities that have been really struggling with COVID. And the youth who truly need a safe place to gather and need the support systems for them and their families so that they can all thrive. And we're very, very appreciative of the city's support and partnering with us in this initiative. So thank you.
Thank you, Dwayne. And thanks again to Joe Lombardi, Erica Clark-Jones, Carly Boos. I know I don't have to tell any of you what a tough year it has been. We have all been living it. Our recovery demands we be laser focused and equitable, especially in times like these, in all of our investments, including our 2020 capital budget. It's important for us to remember the connection as well, in addition to the impact it's having on family stability and lifting up those throughout neighborhoods throughout the city, is the connection between infrastructure investments and the creation of jobs, retention of jobs, and family stability. By investing in infrastructure, we're putting people to work who are helping to support their families, which make for stronger neighborhoods. Investments in infrastructure are incredibly important during difficult economic times. And quite honestly, the best return on investment for taxpayers during difficult economic times is infrastructure, with the creation of jobs, and those jobs then help to fund basic city services through our general fund. It is one of the best things we can do to support families is by investing in job retention and creation in difficult economic times. So with that, I'd be happy to take a few questions from the media, and obviously, members of the press, if you just identify yourself and your news organization, and if your question is for me or one of the other panelists here today. I guess if there are any questions from the press, if you could just use the raise your hand function, and that way we know you will have a question and we'll call on you and hear your question. Is this the first time ever at a capital budget press event we haven't had questions to the press? Now, we were cheating earlier today. I was with Dwayne at the Crittenden site and over in Linden at the Mulberry Place site and at Maryhaven this morning with Sean and his team talking about these investments. So we might have answered most of the press's questions before this event. If there are any other questions from the press that come up, please contact Robin Davis in the Mayor's Communications Office, and whether it's a question for Joe, Dwayne, Carly, or Erica, we'll get you answers to your questions and try to do that by your deadlines. If there's nothing else, I want to thank everybody for being part of this, and so excited about the incredibly important work that's going to have an impact for so many families, children, and neighborhoods throughout our community by working together on these. Thanks so much. Have a great rest of the day.